Welcome to RSCH503, Research Methods and Biostatistics, a 3-credit graduate course offered by Drexel University College of Nursing and Health Professions. As a researcher increases the heterogeneity of a population according to specific variables such as age, race, gender, etc., the sample size must increase accordingly. Also, as we noted previously, increasing the number of subgroups in a population according to specific variables will also demand an increase in sample size. That is, each subgroup size will increase. Small differences on any measure between two populations, thus two samples, require larger samples to detect the differences. The rule is, larger samples are needed to discern small differences. Precision is the accuracy with which the population parameters have been estimated in a study. Discussions of precision ultimately lead to discussions about probability distributions. The normal curve is a probability distribution with a mean of 0 and a standard deviation of 1. Z-scores are standard scores. A z-score value is synonymous with a standard deviation unit. A z-score of 1 represents one standard deviation unit above the mean. Z-scores are often referred to in statistical computations. Recall the central limit theorem. If one takes many samples of a population, and if the samples are large enough, then 1. The mean and standard deviation of the sample means will approximate the true mean and the standard deviation of the population, and 2. The distribution of the sample means will approximate the normal distribution. This theorem underlies much of statistical analyses. The standard deviation is a measure of how much scores in a distribution vary from the mean score. As the standard deviation increases, the dispersion of scores from the mean score also increases. The standard deviation of the mean of a sampling distribution is the standard error of the mean, or the SE, capital S, capital E. Confidence interval is the range the value of the population parameter is estimated to be. Our confidence in a 95% estimate comes from the power of a random sample and the fact that, by the central limit theorem, sampling distributions are known to be normal irrespective of the distribution of the variable whose mean is being estimated. When a researcher has a relatively small sample size, usually 30 or less, the distribution used is called the student t-distribution. The t-distribution, as opposed to the normal distribution, is based on the fact that small samples have a greater chance of inaccurately estimating the parameter of a continuous variable. With small sample sizes of 30 or less, the t-distribution is used to determine the confidence limits around the mean of a population parameter. Recall the notion of power in quantitative research. Power is the capacity of a study to detect differences or to detect relationships that actually exist in the population. Another way to define power is that it is the capacity to reject a null hypothesis correctly. The following factors need to be considered in determining sample size. 1. Effect size, or the degree to which the phenomenon is present in the population, or the degree to which the null hypothesis is false. 2. Type of study, qualitative or quantitative. 3. Number of variables. 4. Sensitivity of instruments. And 5. Data analysis techniques. The opposite of probability sampling is non-probability sampling. In non-probability sampling, not every element of the target population has an opportunity to be included in the sample. Thus, non-probability sampling increases the likelihood of samples not representative of the target population. In quantitative research, two common types of non-probability sampling methods include convenience sampling and quota sampling. In qualitative research, three types of non-probability sampling are used, including purposive sampling, network or snowballing, and theoretical sampling. Theoretical sampling is used in grounded theory research. The researcher collects data from any individual or group that can provide relevant data for theory generation. The data are considered relevant if they include information that generates, delimits, and saturates the theoretical codes in the study needed for theory generation. In convenience or accidental sampling, subjects are included in the sample simply because they were at the right place at the right time. This technique provides little chance of controlling bias. Depending on the nature of the research question being asked, convenience samples may simply be all that are available to study. Recall that convenience samples may be biased samples. In quota sampling, the simple convenience sampling method is used with one additional feature. A strategy is employed to ensure the inclusion of subject types, or strata, in the target population that may be underrepresented in the convenience sample. Researchers may mathematically weight sample values so that they are consistent with the proportion of subgroups in the target population. While quota samples are not unbiased, they are generally considered an improvement over convenience sampling. Purposive or judgment sampling involves selecting specific participants because they are information-rich cases. The investigator decides the purpose she wants informants to serve, and then such informants are located. This technique is commonly used in pilot studies before testing a hypothesis with a representative sample. Investigators most typically use this technique in qualitative research and when critical cases require in-depth exploration. Network sampling is also called snowballing. In this technique, a few participants who meet the criteria are selected. They, in turn, point to others who meet the criteria, and so on. Snowballing is used in obtaining subjects in socially devalued populations, such as child abusers, alcoholics, sex offenders, etc. Investigators must use caution in employing snowballing to obtain a sample. Biases are built into the study since the subjects are not independent of one another. However, one must keep in mind that the subjects do have the expertise to provide the essential information needed to address the study's purpose. We will hear about sampling error throughout our course. Sampling error, SE, is the difference between a sample statistic and the population parameter. A large sampling error means that the sample is not providing a precise picture of the target population. That is, it is not representative. And as we know from previous discussions, sampling error decreases with larger sample sizes. Sampling error reduces the power of a study, or the ability of the statistical analyses conducted to detect differences between groups, or to describe the relationships between or among variables. As with sampling error, the notion of effect size will also be discussed throughout our course. Effect is the presence of a phenomenon. If a phenomenon exists, then the null hypothesis is in error. Effect sizes can be positive or negative because variables can be positively or negatively correlated. A negative effect size is calculated if a treatment causes a decrease in the study mean. For example, an exercise program that decreases weight of subjects. A statistical result is clinically important if the effect size is large enough to alter clinical decisions. Knowing the effect size that will be regarded as clinically important allows researchers to limit the sample to the size needed to detect that level of effect size. This presentation was prepared for graduate nursing students at Drexel University College of Nursing and Health Professions. The primary book used in this research course is The Practice of Nursing Research, Appraisal, Synthesis, and Generation of Evidence, 2017 edition, by Jennifer R. Gray, Susan K. Grove, and Suzanne Sutherland. This book is published by Elsevier Saunders, St. Louis, Missouri.